Good morning, Representative Underwood. Thank you for taking the time to meet with me today. My name is Raina Rivera, and I am a registered nurse currently pursuing my Master's of Science in Nursing to become a family nurse practitioner. I appreciate your leadership and commitment to improving maternal health outcomes through your work on maternal health legislation, including efforts to address disparities in maternal care and expand access to healthcare services. As a registered nurse, I have learned that improving high quality healthcare extends beyond treating physical conditions. It also means recognizing and addressing mental health concerns that can significantly affect patients and their families. One area that deserves greater attention is postpartum depression, which remains one of the most common complications associated with childbirth. According to the Centers for Disease Control and Prevention, approximately 1 in 8 women experience symptoms of postpartum depression after giving birth, yet many women are never diagnosed or treated. This represents a significant public health concern because untreated postpartum depression affects not only mothers, but also infants, families, and communities. Throughout my nursing education and clinical experience, I have become increasingly aware that many mothers struggle silently after childbirth. While the birth of a baby is often portrayed as a joyful experience, many women experience overwhelming sadness, anxiety, hopelessness, or difficulty bonding with their newborn. Unfortunately, because of stigma surrounding mental illness, many mothers hesitate to seek help. Some fear they will be viewed as bad mothers, while others worry that disclosing their symptoms could result in judgment or even involvement from child protective services. These fears often prevent women from discussing their mental health concerns with healthcare providers until their symptoms become severe. Although I cannot discuss confidential patient information, I have encountered mothers who appeared emotionally withdrawn, exhausted, and overwhelmed during postpartum care. Some minimize their symptoms because they believe feeling depressed after childbirth was normal or because they did not want to burden their families. Others simply lacked access to mental health care after leaving the hospital. These experiences reinforce for me the early that early identification alone is not enough. Screening must be accompanied by timely access to treatment, counseling, and community resources if we hope to improve maternal and infant outcomes. The American College of Obstetricians and Gynecologists recommend that every woman receive standardized screening for depression and anxiety during pregnancy and throughout the postpartum period using validated screening tools. While these recommendations represent an important step forward, implementation remains inconsistent across healthcare settings. Many clinics face shortages of behavioral health providers, limited reimbursement for mental health services, and inadequate systems to ensure patients receive follow up care after a positive screening result. As nurses, we play a critical role in addressing these challenges. We are often the first healthcare professionals, who recognize these symptoms. Who we often spend a lot of time with patients during pregnancy, childbirth, and the postpartum period. We build trusting relationships that allow mothers to share concerns they may not express to everyone else. Our responsibilities include conducting screenings, recognizing warning signs, educating patients' families, coordinating referrals, and advocating for timely treatment. We also help reduce stigma by normalizing conversations about maternal mental health and reassuring mothers that postpartum depression is treatable medical condition rather than a personal failure. This issue is not only a clinical concern but also an ethical one. Nursing practice is guided by the ethical principles of beneficence, non-maleficence, justice, and respect for patient autonomy. Beneficence calls us to promote the well-being of mothers and infants through early intervention. Non-maleficence reminds us that failing to identify or treat postpartum depression can result in preventable harm. Justice requires that every mother have equitable access to mental health care, regardless of their race, ethnicity, income, insurance status, or geographic location. Finally, respecting autonomy means ensuring mothers receive accurate information and are empowered to participate in decisions regarding their mental health care. Unfortunately, disparities continue to exist. Research demonstrates that women living in rural communities, women from racial and ethnic minority groups, and women with limited financial resources are less likely to receive timely diagnosis and treatment for postpartum depression. These inequities contribute to poorer maternal health outcomes and widen existing healthcare disparities. Improving access to maternal health care is therefore both an ethical responsibility and a public health priority. Representative Underwood, your leadership on maternal health policy has already made a meaningful difference for families across the country. Today, I respectfully ask you to continue supporting legislation that strengthens maternal mental health care by increasing federal funding for universal postpartum depression screening, expanding integrated behavioral health services within obstetric and primary care settings, supporting workforce development programs that prepare more perinatal mental health specialists, and expanding telehealth services and postpartum Medicaid coverage to ensure mothers can receive timely treatment regardless of where they live. These policy investments will improve early detection of postpartum depression, increase access to evidence based treatment, reduce maternal morbidity and mortality, strengthen maternal infant bonding, improve infant development outcomes, and reduce healthcare costs associated with untreated mental illness. Most importantly, they will ensure that every mother has the opportunity to receive compassionate, equitable, and patient centered mental health care during one of the most vulnerable periods of her life. Thank you again for your time and for your continued commitment to improving maternal health. As a registered nurse and future family nurse practitioner, I am committed to advocating for policies that promote ethical, equitable, and evidence based care for mothers and their families. I hope you will continue to champion legislation that expands access to maternal health care services and supports the vital role nurses play in improving maternal and infant outcomes. I appreciate the opportunity to meet with you today and would be happy to answer any questions you may have. Thank you.